So you have all these risk factors, but now what do you do with all these numbers and everything you just calculated? So what you do is, so we'll just walk through what you would do with a client or a patient that comes in to see you. And this is essentially a case study. This is what a case study is. So you have this guy, John comes in to see you because for a stress test or exercise test or max number of push-ups or something. And now there's three things that you would do. The very first thing you would do is give him an informed consent form. And what this is essentially telling him all the risks and everything he's doing and the liabilities, and you're giving him permission to do whatever the hell you want to him. So in case in the rare instance he does die or suffers a condition or something or passes out, he can't sue you, he's fine, you're fine, and everything. So it tells you the benefits. And then what he does is he signs it. My signature. So he signs it, and that pretty much says he agrees with whatever you want to do with them. And the second thing is a medical history. Has he ever had a heart attack in the past? Has he ever broken his foot in the past? Has he ever had AIDS in the past? Whatever, a medical history. And of course, another thing called a PAR-Q. A PAR-Q is just, I'm sure everyone's had one before. That is the bunch of medical questions and health questions people give you. You just say, yes, have I ever had a heart attack? Have I ever had been lightheaded? Have I ever passed out? Have I ever had heart disease in my family? Have I ever had AIDS? Have I ever had diabetes? Whatever. Just a question answering a bunch of things. And then next you calculate the risk factors. And the risk factors is really the most important one. Well, actually the informed consent is. But then the risk factor comes next. And then you calculate, you do all 8 risk factors like we just did. And based on these 8 risk factors, you have to know all 8 of them for a case study. She'll give you a paragraph, she'll say a bunch of numbers, you have to know the risk factors. And then you just add up all the risk factors. So remember there's 8 risk factors. And I'll just very quickly write them out again. We have age, are they above 45 for men, above 55 for women, family history. Has anyone in the family had a heart attack or heart condition before age 55 if it's a father or brother, or before age 65 if it's a mother or daughter, mother or sister. And then we have physical activity. Are they active at least 3 times for 30 minutes, 3 times for at least 3 months. Obesity. Are they obese? Is the BMI above 30? Hypertension. Do they have high blood pressure? Pre-diabetic. Oh, now another thing about pre-diabetic is you have a glucose test, the fasting glucose test. We'll call it the, it's mostly called the FG, fasting glucose, or IFG, but it's mostly called FG, between 100 and 125. There's also another glucose or another pre-diabetic test called the oral glucose tolerance test, or OGT. What this is they give you a massive dosage of glucose, like a very sugary drink or something full of glucose. So they give you this massive dose of glucose. They take your blood sugar immediately after. Of course, it's going to be high, extremely high after you take a lot of glucose. They wait 2 hours, they take a glucose again, with the idea that in 2 hours it will decrease because of insulin. They wait 2 hours, take it again. And I'm not quite sure when they take the final measure, but you want your oral glucose tolerance test to be between 140 and 199. So it's another pre-diabetic test, so it's either one of these ranges. This one isn't really used a lot. It's mostly fasting glucose because this one's kind of uncomfortable. They give you a very sugary drink. 1, 2, 3, 4, 5, 6. That's 6. What's another one? Oh yeah, another one, big one, smoking. And then dyslipidemia. So dyslipidemia. So you take all these risk factors and add them all up. So say this person has age, they're above age 46, and they have high blood pressure. So they have 2 risk factors. Oh, I guess we have to clear it. But you calculate all the risk factors. And based on how many risk factors they have, you can calculate them, whether they're low risk, medium risk, or high risk for heart disease. And this is just a broad classification, whether they're low risk, medium risk, or high risk. And of course, you want to take utmost caution with a high risk. Low is fine. You can really do whatever you want with them. But low risk, to be considered low risk, you have to have 1 or 0 risk factors. So either your age, and that's it, or another risk factor. You can't have age and family history, which are both non-modifiable, because that will immediately put you at immediate risk if you have both of them. So most older individuals are medium risk because they have age going against them. Most likely, well, not most likely, but if they have age going against them, they'll probably have some lifestyle choice going against them also. But medium risk just means you have 2 or more risk factors. And high risk just means you have a symptom of heart disease. And there's a few symptoms that we'll go over. I'll go coronary cardiovascular disease. You have a symptom of cardiovascular disease, or you've had a past heart condition. So you've had a heart attack at some point in your life, or if you have asthma, that puts you on a high risk. So if you have asthma, unfortunately, you're on high risk. But that doesn't mean, of course, you have a heart attack. That just means you need to have a physical or whatever. And, of course, if you have a metabolic condition, if you have diabetes, that puts you on high risk. Remember that risk factor was pre-diabetes between 100 and 125. Well, if your blood sugar is above 126, that means you, or it's 126 or higher, that means you have diabetes. So that means you're high risk. So what does this mean? Does that mean if you have all 8 risk factors, are you still medium risk? The answer is yes. If you have all 8 risk factors, you're still considered medium risk. Because high risk is irrelevant of risk factors. All it depends on is if you have a symptom showing. So based on the low, medium, okay, well, high risk symptoms of heart disease, we'll go over all the possible symptoms. So if you have any of these symptoms, you're immediately high risk. If you're tachycardic, what this means is you have a high heart rate. Everyone is tachycardic when they exercise, but this means when you're at rest. Tachycardic is a heart rate above 100 at rest. So hopefully no one in this class has a heart rate above 100 at rest, because that's not normal. So what she can do is she can give you all these risk factors in a case study. You calculate them, and then at the end she just throws in, oh, and their resting heart rate is 102. Well, that means they're high risk. So regardless of what you just calculated, they're high risk. You also have something called dysapnea. Now, apnea is anything dealing with breath or breathing. Dysapnea means you have a difficulty breathing, so it's painful to breathe. So that obviously you should not be having pains breathing at rest. So that means you're at high risk for heart disease. Another one's called orthopnea. Since pnea means breath, ortho means laying down. So orthopnea means you have a difficulty while laying down. Again, you should not have difficulty breathing while you're laying down. Another one is palpitations. Palpitations is a fancy word for you can feel your heartbeat. You can actually hear your heart beating. Now, everyone knows your heart beats thousands of times a day, but you don't hear it beat, or you don't feel it. If you hear it or feel it, that's a heart. You should not be aware of your heart beating. So that's a risk factor. Now, other ones you have are intermittent complications, which is like cardiovascular disease in your legs. So your blood flow is decreased in your legs. You have something called syncope. Syncope is a fancy word for passing out. If you pass out, that's not good. So it's a symptom of heart disease. Passing out is most likely being lightheaded because you have low blood pressure and you didn't drink water. You stood up really fast. Now, if it happens once or twice because you stand up really fast, that's not really, I wouldn't consider it high risk. That's just you stood up really fast. But if you just pass out a lot, that's clearly not good. And and the other one's heart murmurs. Heart murmurs are just a defect of the heart. You're born with heart murmurs. You don't just get a heart murmur. And that's also high risk. Now, of course, just because you have any of these things doesn't mean you have a high risk for heart disease. I mean, actually, it does put you high risk. All that means is you need a physician to check you out before you exercise. So now we'll really quickly go over what these mean, because that's important. Low risk means you do not need a physician's approval to do any form of exercise. So exercise. So you don't need a physician's approval for submax exercise. Submax is considered jogging or walking or doing anything leisurely, but you're still exercising, or maximal exercise. Maximal exercise, of course, will be running to your max, working out to your max, doing something to your full max. If you're low risk, you can do these. You do not need a physician's approval. And there's also moderate exercise and vigorous exercise. Now, the cool thing about these is these essentially mean the same thing. Submax means moderate, maximal means vigorous. No one, you know the other. Now, if you're medium risk, if you have 2 or more risk factors, you need an MD's approval to watch you during maximal exercise. Or you need a physician's approval for maximal. And you also need a physician's approval for vigorous, since maximal technically means vigorous. You do not need a physician for moderate exercise. Now, so does that mean if you have all 8 risk factors, do you not need a physician's approval for moderate? Yes. Now, what this is saying is a moderate risk individual, there's still an elevated risk for heart disease, which is why you need a physician's approval for maximal and vigorous. But it's not bad enough where you need a physician, where they can't do a moderate exercise. They can't do maximal without a physician, but they can do moderate. Now, you can probably guess what high risk is. High risk means they need a physician before you even touch them. So before you do any form of exercise, they need to see a physician. And now the way I think about this is, think about it, if you're a personal trainer and a client comes to you, that means you're accountable for them. Now, if someone had a heart attack at some point in their life, or if they're diabetic, or they pass out randomly, or they have difficulty breathing, you're accountable for them. So you don't want to even touch them until they get MD's approval saying they're A-OK, they're fine to exercise. You're allowed to work out with them because you're accountable for them. So that's how I think about for moderate, high risk. You don't want to touch them if they have had a heart attack before in their life until an MD says it's fine to. Same thing for now for medium risk. You don't want to touch them again for maximal exercise. So if you take someone who's a smoker, has high blood pressure, is pre-diabetic, is obese, you don't want to give them a maximal stress test. You want an MD to check them out before you give them maximal. If they're low risk, so if they're like majority of people in the college campus, well, actually I can't really say that because it's a big campus, but most people are low risk if they don't do any of these lifestyle choices. Now, if they're low risk, they're okay to do whatever you want. You can do whatever you want with them. You're accountable for them, of course, but there's such a low risk that it's okay to do whatever you want. So these are the 8 risk factors. You always calculate these risk factors because these risk factors determine how hard you can work them out and if you need an MD's approval to touch them. So you have to know how to calculate these. And the questions that she asks for the case studies are either straightforward, where she says every single number, and you have to know the numbers, of course, and you have to calculate the risks, and you have to actually write it all out. So that's a big tip with Dr. P. Write out everything, and not just her. She prepares you for every graduate class. She's an excellent teacher, but essentially write out everything. When you get to graduate ex-phys, if you take it, Dr. P teaches graduate ex-phys, and 70% of the test is short answer and long answer, so you get really good at writing out everything you do. So it's very good practice to know everything for this class, to know everything about it, to be able to write it out and explain it instead of just memorizing an answer and picking it on a multiple choice. So I have to write out every single thing possible. And you calculate the risk factor. And you can calculate your risk factor and see how close you are for heart disease. And then you can make some lifestyle choices and possibly save your life.